Hello and welcome to the iHeartRadio Inland Empire Community Spotlight. It's at this time every week that we take the time to talk about issues in our community and also allow nonprofit organizations to talk about the services they provide right here in the Inland Empire. I'm your host, Evelyn Arribas. My guest today is Dr. Rick Axelrod. He's the president, CEO, and medical director of LifeStream Blood Bank, founded in 1951. LifeStream today provides blood products and services to more than 80 Southern California hospitals in 6 counties. Before we get into the details of this life-saving organization and what it means for the Inland Empire, let's talk a little bit about you, Dr. Axelrod. Please tell us a little more about yourself.
Sure. So I'm a physician by training. I also have my business degree as well. And I got into blood banking or transfusion medicine actually during the AIDS crisis. I was in training. I was in medical training during that time. And that's when we learned that HIV could be transmitted through blood. And it really opened up the whole new field of what we call transfusion medicine. And I decided that I really wanted to be part of that and to help eliminate the risk of HIV from the blood supply and be part of that group of doctors that would work on that.
That's incredible. That's really incredible. You were kind of there towards the beginning of that then. That's really fascinating. I'm sure you've got lots of stories of, going through all of that.
Yeah, it was really a challenge. And one thing I would just mention is at the time I was training at Cedars-Sinai in Los Angeles. And at that time, when the HIV crisis hit, if you were a patient at Cedars-Sinai and you were transfused, you actually had a 1% chance, 1 in 100, of getting HIV from a transfusion at that time.
Oh my goodness. Oh my gosh. How far we've come.
Yeah, and so we've come very far. Just in perspective, to let you know, nationally, the risk of now getting HIV from transfusion is more in the order of 1 to 2 million, 1 in 2 million or 1 in 3 million transfusions.
Wow, that's incredible. And obviously because of all the screening that goes into it, and we'll get into some of that in just a few. First of all, I think, welcome for being here. Thank you so much for taking time, because clearly you're an important person, based on what you've just said and obviously all of the things I've read in your bio as well. So this is a really incredible thing. And I know we're in a very different time right now with COVID, and there's a lot of questions about all that. So I definitely want to dive into some of that. It bears repeating, though, that LifeStream provides blood for more than 80 hospitals. That's a massive responsibility. So who specifically receives blood from LifeStream?
Well, it would take a long time to name all the 80 hospitals, but
no, go ahead. Take all the time. No, I'm kidding.
just to let you know, we actually serve at least one hospital in all 6 counties in Southern California. So for example, in San Bernardino, we serve Loma Linda University Medical Center, Arrowhead Medical Center, St. Bernardine's. In Riverside, we serve Riverside University Health. We serve Riverside Community Medical Center, Kaiser Riverside, Kaiser Moreno Valley. That's an example. In LA, we service Glendale Memorial Hospital, USC Keck Medical Center. We serve there. In Long Beach, we serve the VA Long Beach, as well as St. Mary's Medical Center in Long Beach. In Orange County, we serve Orange County Global Medical Center, Chapman Global Medical Center, South Coast Global Medical Center. In Imperial County, we serve both hospitals there, Pioneer Hospital in El Centro, and we actually serve the VA in San Diego as well. So, big, all 6 counties kind of spread out, and it's a big challenge and task to be able to do that.
That is, I can only imagine. Now you have many locations, I imagine, throughout all of the region to help fulfill patient needs. Now, I understand, because I've done broadcasts and things like that at fixed locations. Like I've been to the San Bernardino location there, and, where we've tried to do blood drives and things like that. I even remember being in high school and having I think it was like the blood mobile or whatever it was that came to our site. And we had, those that were old enough to give blood there during a blood drive. How does that work? I mean, are these still in action now even with COVID going on?
Yes. So first of all, there are 2 ways to donate blood with us. It's either when we come to you using a blood mobile coach, or or actually bring our equipment to set up in an inside setup. Or you can come to one of our donor centers. Currently, we have 9 donor centers located throughout Southern California. We have one in San Bernardino, one in Central Riverside, one in Moreno Valley, one in Ontario, one in the high desert in Victorville, one in La Quinta, one in Rancho Mirage, one in Southwest Riverside County in Murrieta, and we just opened a new one in Orange County in Placentia. So we have 9 donor centers where people can come and donate, or we come out to your organization or bring our coach and do blood drives there. And the way that you can make an appointment is to go to our website, lstream.org, and you choose whether you want to donate at a donor center, or you could look up what blood drives are going on near you and make an appointment.
Yeah. So that sounds easy enough. And I know there's always a different blood drive. I get a lot of emails that tell me where they're going on. So that's pretty great. Doctor, COVID-19 obviously affecting us all pretty monumentally. What impact has it had on the local blood collection? And as a follow-up, where are we in terms of local blood supply?
Right. So it has been very harmful to our mission for collecting blood because of all the businesses that have closed, because of the schools, high schools and colleges that have closed. These are the primary places that we have done blood drives. And even many blood drives are done at churches, and they have not been having services as well. So in a normal operating setting, about 55% of the blood that we collect is on these blood drives, and 45% are in our fixed site donor centers. As a result of COVID, almost all of our blood drives have been canceled, and maybe 10 or 20% of the blood we're collecting is in the field, and the other 80 to 90% is actually at our donor center. So it's been a real challenge for us. And one of the things I really want people to understand is that coming to the donor center or even booking a blood drive, it is very safe. We have instituted many safety measures to make sure that people have a really low chance of contracting COVID at any of our places of business. Number one, we take the temperature of everybody who shows up at our donor center or a mobile blood drive. And if your temperature is 99.5 or less, you're able to come in. If it's not, then you're going to have to leave and not allowed in there. Once you come in, everything is social distance, 6 foot apart, and you must wear a mask. And we sanitize all of our equipment and all the chairs in the waiting room, all between donors. So we're doing everything we can. Donors have to wear a mask, employees have to wear a mask. Many of our employees are already vaccinated. We're approaching at least 50% of our employees being vaccinated, and they're continuing to do so. Wow. So it's a very, very safe environment. We've been doing this now for months on end, and I can tell you that we have no documentation of a donor or an employee getting COVID from the interaction at the blood drive.
That's fantastic. That's wonderful news. It sounds like you're being incredibly safe in terms of the local blood supply right now with those numbers that you just shared, since the mobile drives haven't been able to bring in as much as they generally would every year. What are we looking at right now?
Yeah, so in normal times, we usually have a 3 to 5 day supply of blood on the shelves ready to serve the hospitals. And that's with the hospitals having their full inventory on the shelf. Right now, we have less than a 1 day supply of all blood types. We are literally living day to day. The blood that we collect on Monday goes out the door Tuesday to the hospitals. The blood we collect on Tuesday is out within 24 hours. We are really living day to day, and we really need the help of the community to come and help us with that. When we normally were collecting about 500 to 600 units of blood a day, now we're collecting more in the order of 300 to 350, so a little more than half of what we used to collect. And that's really not enough to service all the hospitals.
That's really scary to hear that. Anything could happen. We could have a natural disaster. We could have anything that we need these blood, this blood on demand all the time. And even a 3 to 5 day, amount seems low in my mind. And that's what we generally have. So less than 1 day supply really does worry me personally, I know, and probably our community. You're listening to the Inland Empire Community Spotlight. I am Evelyn E. Rivas. I'm talking with Dr. Rick Axelrod. He is the president and CEO and medical director of LifeStream Blood Bank. And we're talking about the urgent need of blood donations, and especially in the time of COVID, where blood drives are really at a kind of a standstill. Hopefully within the coming months, we'll be able to get back to doing what's normal and having, I know, the school sites and all of the different churches and things like that. But can you tell us a little bit about the 2 for 2 community campaign?
Yes. So what's happened is California, the Air Resources Board, they changed their regulations with regards to diesel engines. And the majority of our buses have diesel engines. So a number of them will no longer be able to be used to go out into the community and collect blood by December 31st of this year.
Oh, wow.
Full coaches have to be retired and no longer used. So we now have to purchase 4 new vehicles to collect blood in the community. Each of those vehicles costs $250,000. So it's going to cost us at least $1 million to be able to repurpose these vehicles and get new vehicles. So we wanted to do a campaign where we said, the blood bank can afford to replace 2 of them on our own, but we'd like the community to help us to raise money for the other 2. So that's the 2 for 2. It's to contribute at least $2 to help us raise up to $500,000 to purchase those 2 other blood mobiles. And, the Inland Empire in particular is 4.5 million people. So if we just had 250,000 members of the community donate $2, we'd get our $500,000.
And $2 is, come on, that's less than your coffee. That's half of your coffee. When you stop by any coffee establishment, I'm going to tell you right now, wow, that's a great program. Unfortunately, that you have to retire those diesel engines for that reason, because of course they're needed. So, okay, 2 for 2, $2 to raise the amount needed to get those other 2 trucks that you need. Tell us how our listeners can help, like right now.
Sure. So first of all, they can go to our website, which is lstream.org/new bus, and that'll take you right to the screen where you could donate money. And it gives you the option to donate $2 or more if you want to. And it's a very, very easy process. So they can help us with that on the 2 for 2 campaign. Of course, the other way they can help us is really come in and donate blood, because that's really what we need right now to make sure that the hospital patients are taken care of. And I really ask people to think about this as a pay it forward type activity, because we all may be hospitalized and need blood in the future. Yeah. Because of heart disease, because of cancer, and those type of things. So we would, if we're faced with those diseases and we need treatment, we would want our fellow neighbors to be donating blood to help us. So while we're healthy now, let's pay it forward and donate that blood so that all these procedures can go on and the people can be taken care of.
And really what you've given us through the course of the last few minutes is a couple ways we can help. Not only, like, there are people out there that are maybe a little apprehensive to donate blood, or maybe are not able to do that at this time, but they can donate $2. They can donate, or however much they possibly can. So that's great. I mean, that literally speaks to probably everyone listening right now. lstream.org/new bus. Is where you want to go. Again, you're listening to the Inland Empire Community Spotlight. I am speaking with Dr. Rick Axelrod, the president, CEO, and medical director of LifeStream Blood Bank. There are so many things that come to mind when we give back to the community. There are lots of nonprofits out there. There are a lot of there are cancer organizations out there that are doing the good work for cancer patients. There are organizations doing things that serve our homelessness or hospitals, things like that. What I love about LifeStream is that it serves every one of those things. It is all encompassing, because everyone needs blood. And at some point, every one of those organizations has come through a hospital probably, and maybe one of their patients has needed blood. So this is vitally crucial, and getting involved with an organization like LifeStream is doing your part for your community, realistically, right?
Yeah, and also just for your listeners to know, if you reach the age of 80, there's an 80% chance that you will need a blood transfusion. So sometime in your life, you're going to need a blood transfusion. And one of the other things I think about donating blood that's so special is there are really rare opportunities we have to save somebody else's life. If we're driving on the freeway and somebody has an accident, we may have the opportunity to stop our car and help the person in the vehicle. But really, the simple act of kindness of donating a unit of blood, rolling up your sleeve, and donating that unit of blood can save up to 3 lives in the community. I mean, that's really something special. It's easy and you're saving lives. And there's not many opportunities where you really get the opportunity to do that.
So you're saying one donation could save up to 3 lives?
Yes, because we make multiple products, not only from a unit of whole blood. We have the red cells that are what everybody thinks about when they think about a pint of blood, but we also have the plasma and we also have the platelets. And so those go to, plasma is used for people that have bleeding disorders. Platelets are used for cancer patients. So your donation can be sent to 3 different hospitals to help 3 different patients in the community.
I heard recently that LifeStream was doing some things with COVID-19 patients that had already had it and are recovered now, but may have antibodies. Can you tell me a little bit more about that?
Yes. So that's our convalescent plasma program. So people who have had COVID and recover, they develop antibodies to the virus. And what the studies have shown is that if we can collect the plasma from these individuals that contains those antibodies, and that product is transfused to a patient in the hospital with COVID, that it could be beneficial and help them potentially from progressing to worse conditions that might require them to be ventilated. So if your listeners are in that group that have recovered from COVID, then we ask them to go to our website, another one, lstream.org/COVID plasma. And that will take you to a sign-up sheet where you get to fill out some information that allows us to screen and let us know whether you're available to and whether you're the right type of donor to donate that plasma for us.
Wonderful. lstream.org/COVID plasma for that. I thought that was really fascinating. And we're learning so many new things, through the course of the year, we've all had to kind of move and shake and learn new things.
Your neighborhood grocery outlet invites you to stop by this week for these amazing deals. Your furry friends will love it when you bring home Blue Buffalo pet food and treats. We've got a huge inventory, so stock up now and save up to 60% versus traditional stores. Also, enjoy a refreshing Stoke cold brew coffee. 48-ounce assorted varieties are just $1.99, a savings of up to 60%. Offers good through March 23rd.
Grocery Outlet Bargain Market.
As we're going through and new ways that obviously LifeStream is saving lives in another arena.
Yeah, in fact, during the height of the pandemic, when we had that surge in December, our hospitals were using about 70 units of those COVID plasma a day. That's gone down a little bit now because things have quieted down a little bit. But now with the new COVID variants and other things that they're talking about, we don't know that we're out of the woods yet and whether we might have another spike in the future. And so we're making sure that we're collecting that product and having it in inventory to prepare for the next surge in the event that happens.
I'm glad we have organizations like yours in our community to do that work. Obviously very necessary. This is the Community Spotlight, and we are talking with Dr. Rick Axelrod from LifeStream Blood Bank. Can we talk again? I want to reiterate in case somebody just joined us right now, how they can get involved with LifeStream, how they can donate, where they can go.
Sure. So if there are multiple things, we're talking about donating blood. They can donate at any of our 9 donor centers that are located in the community. I'll mention some of them, but all this information they can get at lstream.org. And if they say, and then there's a button there about, I want to donate blood, and that'll give you all the information. But we have donor centers in San Bernardino County, Riverside County, Ontario, High Desert, in Victorville, in the Low Desert, La Quinta and Rancho Mirage, Southwest Riverside County in Murrieta, and a new donor center in Orange County in Placentia. You can also donate a blood drive. Again, if you go to the website and say, I want to donate blood, it will tell you what blood drives are going on over the next week. So you can choose any of those blood drives and make an appointment there. So they can really help us by donating blood. The other way they can help us is our 2 for 2 campaign, where we're trying to raise $500,000 to purchase 2 new bloodmobiles, because the bloodmobiles we have to be retired and no longer can be used after December 31st of 2021, because California emission standards will no longer allow those buses to be used in California. So we have to purchase new buses. So the 2 for 2 campaign is donate $2 to help us raise money to purchase 2 buses. As I mentioned, we're trying to raise $500,000. We have 4.5 million people in the Inland Empire in San Bernardino, Riverside County. So if we only get 250,000 of them, which is a small fraction of the 4.5 million, to donate $2, then we get our $500,000. So they can help us that way. If they can't donate blood, they can also, schedule blood drives. If they can get their community to want to do a blood drive, we'll bring the bloodmobile out to your area. So we like to have a minimum of 20 units scheduled, 20 people scheduled. So if you can go in your neighborhood and get 20 people to sign up and agree to do a blood drive on a certain day, we would be happy to come out and do a blood drive in your community. And that would be very helpful as well.
Only 20 people is all you need. That's so doable. That is doable. Let's talk about those numbers again. If in case someone is just now joining us, we are generally on a regular year, on a year where we would have mobile drives and things like that. You have a supply of 3 to 5 days worth of blood in these hospitals and things, all of the hospitals, the 80 hospitals that you serve. Right now, we're at less than a 1-day supply. So the need is vital. It's very, very crucial. What happens can it get any lower than this, really?
It really can't. And again, as I mentioned, with the hospitals and LifeStream working day to day to make sure the patients are taken care of, but it does affect their work. I mean, if you're a cancer patient and you need a transfusion, you might have to wait an extra day or two than you were normally scheduled in order to get that done. If you're going for elective surgery, you might have to wait an extra week in order to get that done, because the hospital wants to make sure, and we want to make sure, that there's enough product on the shelf. So it really has been challenging. And as you mentioned previously, that's without any emergencies. I mean, if we have like a bus crash that has 30 people in it, or we even have an earthquake that results in damage where people are affected, that would put us into a real critical situation. And you always want to be ahead of that situation. You always want to make sure you have more blood on the shelf than the hospitals need to prepare for those emergencies. So that's why we have an urgent appeal out right now. We are in a major blood shortage of all blood types, and we just need our community to step up, come in, make that appointment either at any of the 9 donor centers or at the mobile blood drives that we are doing right now. And also to reiterate, if somebody new just came on, is it's safe. We have put all COVID safety precautions in. Donors have to wear masks. Employees have to wear masks. We take the temperature of every person coming into the center of the blood drive to make sure that they don't have a fever, so that they're allowed in the door if they have a normal temperature. Everything is 6 foot apart, so if social distancing, and we sanitize all the equipment and the chairs and everything we use after each blood donor to make sure that everything is COVID safe.
Can people volunteer right now? I know things, generally I know you have a volunteer program. Is that still active? It
is still active. And so, again, we definitely need volunteers, particularly for staffing our blood drives and working the canteens and, where the donors are recovering and giving them the goodies. And then also for driving for us, helping us deliver that blood. We have, we really need volunteers who like driving to be able to help us to deliver that blood or pick up blood from blood drives and bring it back to the center so that it could be processed, or deliver the blood to the outpatient transfusion centers that we serve. So those are the 2 areas that we really need help for volunteers in the area.
That's easy stuff. If you like to drive around the IE, there you go. You could be helping save lives every single day by working with LifeStream. You can go to lstream.org for all of the details. And I'm sure there's a link there that says how people can get involved and volunteer right away. I thought of something very interesting. I was talking with a friend the other day who didn't know their blood type and was asking their mom and, I don't know what my blood type is. And I thought to myself, what a great way to find out your blood type. Go and donate blood. You'll be saving a life. And I'm sure you give that information to everybody, right?
That's correct. And, it doesn't happen on the day you donate because we have to send the blood for testing. But you get to know your blood type. And I agree with you. I think everybody should know their blood type because if something goes wrong and you need to get a transfusion, you want to make sure you're getting the right blood. But the other thing, as you mentioned, that testing is when you come in to donate blood, actually a bunch of good things happen for you. First of all, you get a mini physical, right? We take your blood pressure to make sure that's normal. We take your pulse. We take your temperature. We check your iron level. So that's number one. Number two, when you donate blood, we do all this testing on the blood supply, free testing for you. So we test for hepatitis. We test for HIV. We test for West Nile virus. We test, and now we're testing for COVID antibodies. So because if you're positive for COVID antibodies, that's an opportunity for us to see whether you want to join our convalescent plasma program. We also do a cholesterol test on every donation, so you get to know your cholesterol as well. So the act of donating blood, not only are you saving somebody else's life, but we do a little mini physical on you. And one of the stories I like to tell is we have a number of stories where the donor has said, donating blood saved my life. Wow. Because when they donated blood, we found an irregularity that forced them to go to their physician to get looked at, and they wound up having an underlying medical condition that got treated. So for example, somebody who always was able to donate blood all of a sudden came in and they were anemic. And that was very unusual for them. So we said, you should really see your doctor. Well, they found out that they got tested, they had a colonoscopy, and they actually had the beginnings of colon cancer. And so it was treated immediately. They didn't need any other therapy. And so that was one of the benefits. Somebody came in, we tested their pulse. It was an irregular pulse. We said, you really should go see your doctor about this. It turned out that they had atrial fibrillation and had needed treatment for that. So it's funny, it's not only about saving somebody else's life, but you really get a free mini physical and free, lab testing that can give you information that can help you manage your life as well and potentially save your life.
Well, that is a great reason to go in and actually donate, if for nothing else, to find those things out about yourself if you don't know them. Wow. And there's a lot of people I see also in the community. I've seen it in maybe the Press Enterprise or newspapers who hit these monumental donor amounts. Can you tell us about some of those? Sure.
So the big one is the first one is the 10-gallon club. Mm-hmm. If you make it to 10 gallons, we have an annual event, normally attended by 1,200 people, where we recognize all of the donors who have donated at least 10 gallons in their lifetime or more. Now, we have a very few number of people who have actually reached 100 gallons in their life.
Wow.
They've been donating since they're 18 years old. Mm-hmm. They donate platelets, most of them who've reached 100 gallons. When you donate platelets, you can donate 24 times a year. And they've been donating every 2 weeks for 40 years. And they 100 gallon. And we have 2 donors who have actually surpassed 150 gallons. And they're competing against each other because they want to be the number one when we give our awards every single year. And it goes back and forth. So it's really kind of a really nice, it's a nice friendly competition. And at the same time, the benefit is they're saving lives in the community. Donating 24 times a year platelets to help 24 patients, in the community is really a wonderful thing.
Wow. Those are heroes, big heroes, real life heroes, saving lives every single day.
Yes.
That is incredible. 150. I'm picturing that much. And that is a lot. Wow.
Yeah, the most you can donate is 8 gallons a year. That's the most. So if you take 150 and you divide it by 8, that's like close to 20 years. It's about 19 years. So that they've been doing that regularly. So it's interesting. The number one person who is our highest 150 gallon, he's in his mid 70s, and the guy who's right behind him is in his late 50s. So he's, he ultimately he's going to be able to pass him. But the gentleman who's in his mid 70s, like clockwork, comes every 2 weeks and is healthy and fit. And that's the other thing to let people know. There's no upper age limit for donating blood. As long as you're healthy and able to do your normal activities, you can come in and donate blood. We have donors that are close to 90 years old that are donating blood with us.
Wow, that is so cool. And because things are so safe at LifeStream right now, and there are so many protocols in place, especially right now, it is safe for all ages to come in and donate.
Yes, it is very safe with all our COVID safety protocols. And I'll mention again that, we follow our donors and our employees and make sure people get COVID tested, antibody tested. We have not had one reported case of transmission from an employee to a donor or a donor to an employee since the COVID pandemic began.
Tell us again how listeners can contact LifeStream with questions about blood donation. If they didn't catch something we were talking about, maybe how they can fight back against that blood shortage that we clearly have right now, and how they can set an appointment and give the gift of life.
Right. Well, the easiest thing is go to lstream.org, and there we have many tabs that you can follow, whether it's donating blood or wanting to schedule a blood drive or donating convalescent plasma. All those tabs are on the main website, and they can get their information answered that way. If after that they still have questions, they can call us. Very easy to remember, 1-800-TRY-GIVING. And you can just call us and follow the automated algorithm, and you'll get to the right person that'll be able to answer questions for you to be able to donate. The other thing I just want to mention is in 2021, we started a Count on Me campaign because we wanted to try to get people to donate more frequently. So if you donated one time in 2020, donate at least 2 times in 2021. If you donated 3 times in 2020, donate at least 4 times. So now every 2 months, we have a new donor recognition item that we give to a donor when they come in. So in January and February, it was a long sleeve t-shirt that had Count on Me and the LifeStream logo. In February and March, it's like a golf cap, or a baseball cap, adjustable. So any size head it fits. There's going to be a beach towel as we get closer to the summer. So really to try to encourage people to come in, they get a little something as well, and they can collect all the LifeStream swag and really be ambassadors for us, even when they're not donating, when they're out on the beach or they're out on the golf course or the baseball game, or just wearing any of the t-shirts that we give out as well. So, and that's to try to encourage them we can count on our local population to make sure our mission for saving lives is achieved and that they're helping with that, and we can count on them.
And the food is really good in Triage. Let's throw that out there as well.
It is good. We have potato chips. We have cookies. We have, we have all this great stuff. We have some healthy stuff too.
Yes.
If you want that. But we have a lot of really good snacks for people to eat after they donated blood.
Well, I've been talking with Dr. Rick Axelrod. He's the president, CEO, and medical director and ambassador, I will say as well, of LifeStream Blood Bank. The need is now. The time is now to donate. If you've been thinking about donating, if you've thought about it in the past and gone, I'm not sure I'm ready. Now is the time. Less than a day's worth of blood supply right now, with our mobile giving kind of halted right now and only in certain spots. So get out and donate, not even just blood, donate money if you can, and donate your time if you can as well. Thank you so much, Doctor, for joining us today. Really valuable information. Is there anything you would like to leave us with?
Just thank you for helping us spread our message. I mean, our mission is we help save lives by connecting donors and patients through the gift of blood. And the only way we can do that is if the donors come in, so we could send that blood to the patients to make that connection. So it's really exciting. The other thing I just want to mention that we didn't talk about is one of the programs we started is that we notify the donors of where their blood went to, what hospital it went to. we can't give any more information because of HIPAA privacy rules, but, you'll donate blood and you'll get a text, a week later that says your blood went to Loma Linda University or went to St. Bernardine's Medical Center. So that's another thing that we've implemented to try to make that connection so that people say, oh, wow, I really was able to help somebody in Southern California. And now I feel even closer than just the general that I donated blood. And I know it's helping somebody, but I don't really know where it went. This makes it a little bit more personal to help make that connection stronger.
What a really cool program to start. Well, I cannot wait to go donate. I'm going to donate as soon as I possibly can. LStream.org is where you want to go for all of the information, or you can call 1-800-TRY-GIVING. Thank you, Dr. Axelrod. We really appreciate you joining us today.
Thank you for helping us spread our mission.
And we thank you for joining us and listening to another iHeartRadio Community Spotlight. I do hope you'll join us every single week as we shine a local spotlight on important issues, local organizations that are dedicated to making the world a more well-informed place and better place overall. Until next time, thank you for listening.
Spring into Lowe's and plant the seeds of possibility. With premium mulch for just $3.68 a bag and Stay Green 1 cubic foot garden soil just $4.28 a bag, you'll grow possibilities right from the ground, like skipping the grocery store because your yard grew the whole salad. And it grew you tulips, too. Oh, yard, you shouldn't have. Visit your local Lowe's or shop online at Lowe's.com. Lowe's, home to any budget, home to any possibility. While supplies last, mulch offer in store only. Selection and offer availability varies by location. Offers valid through 3/10, U.S. only. Excludes Hawaii.